Again, we want crispidus because not only is it high in in vaginal health, but even for bladder health, it's seen for women. And I think for men too. We just don't, it's extinct almost. So here's a meta-analysis for urinary tract infections for women and what herbal medicine does. And they looked at 3 different studies. One thing awesome was no adverse effects were reported. They were tracking it in 2 of 3 of the studies. Chinese herbal medicine had a higher rate of effectiveness compared to antibiotics in one study, but in another 2 studies, it was not. So that was 120 patients involved with 2 studies. They looked at Chinese medicine alone, they looked at antibiotics alone, and then they looked at the combination. And they, of course, they found the combined intervention to be a much higher rate of effectiveness for acute UTI, much higher. And when they looked at the long-term outcome 6 months later, much lower rates of recurrence, which is really great. But they still had a recurrence rate. So again, it was only 53% risk reduction. For the other, half, like I wonder if they had used probiotics, vaginal probiotics, as well as oral probiotics here, if they use peptides. That would be a really interesting study, I think. So there are different Chinese medicines. Xian Tang was more designed for acute infection, and they found that it was more effective compared to this other formula. And some formulas, they're more effective. They're designed for recurring UTI, and they're more effective than ones that are just used for acute UTI. So I think the way the formulations work, the people who formulate them, they really keep that in mind. Now, how is intravaginal estriol for preventing urinary tract infections? So Raz and STEM, they looked at 93 postmenopausal women. They applied intravaginal estriol, and they saw a 10-fold reduced in incidence of UTIs. Is that curative? That's pretty curative, actually, huh? They also did cultures. Lactobacilli was absolutely absent in vaginal cultures, but they reappeared 1 month after the estriol treatment, and in 61% of the women, not all of them. And when they looked at the placebo group, the postmenopausal women, there was no resurrection of lactobacilli for them. With use of estriol, the pH went to the optimal from 5.5 to 3.8, and that was statistically significant, p less than 0.001. And again, with placebo, no changes at all. That's why HRT and peptides, they really can bring back and regenerate us to a healthy self without some other things needed. It's just so, optimizing every part of us is what brings about optimal health. So the rate of colonization of a known uropathogen, Enterobacter, it fell in half, more than half, 67% to 31 in those who received the estriol, but in placebo, not changed at all, less than 0.005. So very few side effects, if any, but almost a third, 28%, probably because it's messy, decided to discontinue treatment. So why do we have all these changes for, interstitial cystitis, so much pain in our different organs and our gut and heartburn and peptic ulcer disease? Not having our core microbiome, wherever the core is, whether it's bladder or vagina or gut, is really leading to some pretty severe conditions. So I went over yesterday, I'm going to review it again. We have several studies that are showing that interstitial cystitis is basically a mast cell condition. And with mast cell activation, just like in allergic rhinitis and asthma disorders, in chronic inflammatory disorders like vulvodynia, intestinal ulceration, RA, and Crohn's, mast cells are involved in all of these. We know that. And actually, in all of these, there's mold involved, and huge fungal overgrowths and viral overgrowths. In intestinal ulceration, we know there's even an H. pylori involvement. H. pylori is really hard to eradicate. H. pylori is found to live inside Candida. And so I think this is also the same happening to many other sites in terrain. RA, it's the joint. We're probably having co-infection of bacteria inside a fungal element, Candida. And for sure, probably Crohn's as well. All Crohn's cases I've seen in IBD cases, they all have H. pylori. Same with every vulvodynia case actually as well too. So in one study by Hanno, they looked at the painful bladder syndrome and interstitial cystitis. They found mast cells are found in stress-induced neuroinflammatory diseases, and this includes interstitial cystitis as well. The pain modulation is definitely involved. Mast cells stimulate those secretion of these neurotransmitters. The activated mast cells then produce like neuronal sensitization, and you mix in there all the cytokines and chemokines and histamines and other polyamines. These are all vasoactive. You're getting like this big storm of problems. And so many similarities that mirror and parallel vulvodynia. So with mast cell, we have to look at what is at the root. It's not always what we think. So that's when testing and not guessing is super helpful. With vulvodynia, you can test and not guess. I showed a case with IC, interstitial cystitis. I think it's good to look and drill down all the co-infections and see them improve over time, especially if you have IgG data. So I reviewed this study yesterday in BV women. I want to bring it up again because they found a fourfold decrease in the colonization of urea plasma in women just using probiotics. It was just a 4-week supplementation with a 3-strain probiotic. It was so interesting. They actually found no change in vaginal microbiome diversity or composition compared to controls, but symptoms got somewhat better, and they saw this dramatic reduction in urea plasma from 3.52% down to only 0.77%. So how does the microbiome affect interstitial cystitis? So we're seeing just more studies that have come out just in the last literally a couple years. There was a longitudinal study using next-gen sequencing. They saw higher significant correlations in fungal symptoms in IC patients who had complained of high urinary symptoms versus those with low symptoms. They're all IC, but there's a flare, and they could see with more symptoms this correlation with fungal. Now, they also looked in these patients if they had a flare and then looked at their fungal using next-gen sequencing compared to those that didn't report a flare, and they saw a 4-fold increase. 15.7% had fungal elements identified versus 3.9% who weren't in a flare. So the presence of an higher abundance of candida and malassea were seen when they had these higher urinary symptoms. This is very similar to other conditions like inflammatory bowel disease, where Sokol et al. In his group back in 2016 saw more viral overgrowths, more fungal overgrowths in IBD clients. This study by Nickel, he also looked at those with high urinary symptoms, and these people had some other conditions like IBS and chronic fatigue and the bladder pain syndrome. So overwhelmingly, our bladder can be not just have candida, but can be, of course, infected with Cryptococcus, Aspergillus, Mucor, Histoplasma, Blastomyces, and Coccidioides. It's definitely vulnerable, especially under immunocompromised states, which is mold and Lyme. Definitely now with the spike protein, so much immunocompromised state with antibiotics used over and over again. There are people out there who want to kind of take ivermectin whenever they feel ill. And I'm like, why are you doing that? That's crazy. So there's definitely a shift. People also are more stressed out. So this article by Brandt, he was proposing, thinking about fungus and prevention and control of fungal infections for those who have grafts, prosthetic grafts, breast implants, dental implants, knee or or hip or shoulder implants, anyone taking immunocompromising drugs like steroids or Humira and other biologics, and definitely the use of chemo agents and anti-neoplastic drugs. Definitely want to think about fungus all the time. So when we compare the bladder for the bacteria, I see people had higher Ralstonia compared to controls. And then those, interestingly, I see people had less lactobacilli and less Acinetobacter compared to control. And we always want to look at the menopausal status. Is it, can we help them with their status and estrogen dominance and bring back some of their hormones?